More than 5 million people are now known to be infected with the coronavirus. New infections are easing in Europe and the US, but experts say a second wave is inevitable. In Latin America, new cases are surging. Brazil, which reported the continent's first case back in February, is seeing the most new cases. On Wednesday alone, the country recorded almost 20,000 new infections. If the trend continues, it's likely that Brazil could soon have the second highest number of cases in the world. I'm now joined by Christian Lindmeier from the World Health Organization in Geneva. Christian, the WHO says 106,000 new cases have been reported in the last 24 hours, the most in a single day since the outbreak began. As lockdown restrictions are eased in many places, we're still far from out of the woods, are we?
Indeed we are, and good day to you. If we look at the global trends, we do not see a decrease. We actually see a small incline still. And that shows us that, exactly as you just mentioned, the going down of figures in Central Europe and also in some other parts of the world is not the complete picture. It's not that if we turn off, like turning off a faucet, and then suddenly there's no more drops of cases anymore. The cases continue, and actually we will see more cases in many other countries who have been only starting to be hit by the virus now and who may have a weaker health system. Especially the cases in Brazil also show us that it is important to have an all-society approach to fighting the coronavirus, to fighting the COVID outbreak. Because this way, you need to include, instead of polarizing, you need to include everything from the health system to the people to the economy. Only then can you win this fight.
Christian, you just mentioned Brazil. The situation there seems to be worsening significantly. Where else do you expect such escalations?
Well, unfortunately, we have, first of all, to see that countries, the low and middle-income countries also in Africa, may certainly be a problematic case soon. So also the rest of Latin America. Because these countries only started to see cases now. And remember, we were talking about a window of opportunity for about 2 months that we can prepare these countries, and these countries can prepare themselves. We can help them to equip, to get the tests ready, to get the hospitals ready, to get everything ready, what they need. A lot has been done. More than 130 countries have received assistance from the World Health Organization, but they will still seem to be receiving cases. And of course, another reason for increasing cases will be that countries, as they start easing the lockdown, people will start mixing again, will go on holidays, will start being in contact again. And soon, so we should expect a rise in cases again.
The European Union's virus response chief says Europe has to prepare for a second wave. When does the WHO expect that in Europe?
I don't think we can call it a one wave, or we should not look for one wave. What this wave means, it's an uptick or another rise, a relapse in cases after we have been seeing drops in cases, after the daily increases have gone down. With all the easing of measures now and the communicating and increasing the physical contact of people again, we will see a rise in cases again. And this is the second wave everybody's talking about. They may not all be at the same time. This may be very different from country to country or from region to region. But a rise, a secondary or third rise in cases is very likely.
Christian Lindmeier, the WHO in Geneva. Thank you.
Thank you.
Now, time for some of the other coronavirus developments. The Chinese city of Wuhan, the epicenter of the outbreak, has issued a total ban on hunting, breeding and eating wild animals. Research suggests the virus most likely spread from wild animals to humans through such practices. A top US scientist has said people should not count on a vaccine being developed soon. William Hazeltine said the best approach was to manage the virus through contact tracing and strict isolation measures when it starts spreading. Iran's deputy health minister says some 10,000 health workers have been infected with the virus. And a meat processing plant in the Netherlands has been closed after some 45 employees tested positive for the COVID-19 virus. It's the latest in a number of large outbreaks in slaughterhouses. Turkey's economy was facing hard times well before the pandemic. Now it's in crisis mode. Business has plummeted and the value of the national currency, the lira, has fallen. Much of Turkey's debt is in foreign currency and that means it's getting a lot more expensive to pay down.
Hotel owner Davis Shendomush now has to drink his tea alone. The once bustling streets in Istanbul's world-famous Sultan Ahmet neighborhood are empty. Shendomush's hotel has been closed since mid-March. The tourism season here kicks off in March, and then we usually have some very busy months until November. But so far, we were only able to make 10% of our yearly earnings. If it goes on like this, we'll have a loss of 90%. And it's not just the hospitality business. Government revenues are also taking a hit due to the lack of tourists. Turkey's government will need to service an external debt of some $170 billion by the end of the year. The Turkish lira has now tumbled around 15% against the US dollar since the beginning of the year.
In this time of crisis and uncertainty, a lot of investors are opting for much safer currencies, which is obviously the US dollar at the moment. So that's one channel through which the lira has lost value against the dollar. The second one, however, is Turkey's its own macroeconomic vulnerabilities, and Turkey got caught up in this crisis at a very fragile state, already with a weak currency since August 2018.
Meanwhile, Turkey's president, Recep Tayyip Erdogan, has blamed the lira's plunge on foreign banks, and is calling on citizens to donate to those in need during the pandemic. Little comfort for those who've lost their jobs. The cost of living is rising. My weekly shopping was less than 150. Now I need 300 lira, and it's still not enough. Everything is so expensive. I suffered a lot. My company didn't support us. The state isn't protecting us. No one is helping. Hotel owner Davis Shendomush doesn't know what will happen next. And he has bills and debts to pay and no incoming revenue. It's a bleak forecast ahead of what would have been a profitable summer season.